So, yeah, I want to start by saying that this is a worldwide problem with the aesthetic surgery field, honestly. And it's weird that we're still debating on in terms of safety, which is a crucial part of this whole problem. Like, who is responsible of performing this and who shouldn't be performing cosmetic surgery procedures? The reasons why a certified plastic surgeon and reconstructive surgeons should be the only specialist performing a tummy tuck or a mummy makeover, it's or are the same reasons because a certified ophthalmologist should be the only one performing a cataract surgery, or the same reasons why a cardiovascular surgeon should be performing a cardiac valve surgery. They are just better prepared, but just by definition, and wait great distances to prepare and provide the best environment for patients in terms of safety and in their path for surgery before, during, and after the procedure. Worldwide, in terms of like plastic surgery, the path to become a certified and reliable surgeon goes pretty much the same. You have to go for like general medicine and general surgery for 4 to 6 years. Then you have to go to a reconstructive specialty, that's 2 or 3 years, and then cosmetic surgery, that's another 2 or 3 years. So just in the cosmetic reconstructive field, these specialists are spending around 6 years of training, and the other option is going to a general surgeon who went to or took a master's that lasted 6 months, 12 months tops, and they start performing complex procedures. They don't have the resources, they don't have the skills, they don't have the preparation, and it takes few things in a row for a disaster to come to appear. So it should be a no-brainer. Every country has its own councils, organizations that are officially accredited, and there is a very clear line that defines who is a cosmetic surgeon or a certified plastic surgeon. So it's important that we all join forces on this. Unfortunately, it also not only brings on safety to patients and bad stories that are terrible news for the families, for the patients, but it also like taints and and gives a bad name to a beautiful specialty, which is cosmetic surgery. It helps so many people every year, and I've been involved 12 years in this field, and I've been knowing that without being, of course, a doctor, and I don't. It's important to see what level of importance it has reached in our lives today. And when you have a good professional, a trained professional, a certified professional, and you do your job as a patient, things are highly chanced that are going to be they're going to turn out well, and the risks are diminished by minimally. Unfortunately, the problem arrives when between the patients that are seeking like the less or the least cost possible, some of them are pushing and they understand that that doctor is not certified, and they want to run that risk, which it's their own body, so I don't really understand that part. And the other ones are also because plain and simple they are not well educated and they fall into hands of these unprofessional practices. So I know that the law still, there are loopholes that covers this and allows this to happen in countries, but I definitely think that is something that we should all pay attention. And actually the councils, these organizations, they have to do a better job. They are definitely not creating the right education on patients. You rarely see them on advertisement. You rarely see some organized message. They only appear after a tragedy has happened. And I say this because I see that this happens in most countries as well. So these organizations have to step up. They have to create a more clear message. They have to unify that message and continue the work. I mean, it's not easy. I know that it's not easy. That's not the only strategy to take in place, but I definitely see that. I think there is an area of opportunity with that to have more participations in the media or on online, and market these safety approaches, and patients have a better education about this whole thing, because one thing is real: the the demand for cosmetic surgery is only growing and growing and growing. So that's my opinion. Hope you like it. Follow us. Follow my medical vacations in our channel.